A study shows that the use of dexamethasone on COVID-19 patients in ICU has resulted in a 25% decline in South Africa's mortality rate among the critically ill. Health Minister Dr. Mkhize says at the start of the pandemic, ICU mortality was at 80%. The country has recorded 8,884 coronavirus-related deaths.
That up to now, our government has displayed its readiness and has thus far coped with the surge. We remain committed to taking all the measures necessary to protect our people. It appears we may have benefited from the treatment development as we were experiencing the surge. Our indications are that there has already been an improvement in the survival rate from our ICU, where the mortality has been reduced demonstrably. One study showed that ICU mortality has been reduced by about 25% since the introduction of dexamethasone on June 16. In other studies which is monitored by the MRC, ICU survival rate showed a dramatic improvement at 30 to 40%, whereas ICU mortality at the beginning of the pandemic was around 80%. Notwithstanding these encouraging scenarios, we have directed all provinces to enter into service-level agreements with private healthcare facilities to ensure that when the bed shortages are experienced, that alternatives can be explored.
Well, let's discuss this further. We're joined by Professor Marc Mendelson, who is the Professor of Infectious Diseases at the University of Cape Town. Professor Mendelson, good evening and thank you so much for your time. Let's begin firstly with some of the trends that we're watching coming when it concerns the COVID-19 trajectory in South Africa. And looking at the Western Cape, where they say there's assumptions that the growth of COVID-19 has somewhat peaked and that it's in fact at a stable point now. Speak to us a bit about that.
So the cases in the Western Cape have plateaued. We've seen that over the last 3 or 4 weeks, that the numbers have come down slightly from their maximum and are now running at a fairly steady level. They haven't come down completely in any way, shape or form, but they certainly have plateaued. And we're seeing that particularly in our hospitals. We're experiencing that day to day, both in our admissions to the wards and in the ICU and in our testing centres. So the plateau, certainly from on the ground, is a real issue here in the Western Cape.
And I imagine that if you're still reporting a high number of hospital cases, because the Western Cape and the number of people that they're testing, of course, is quite limited, so that's not really a fair reflection of what the state of the cases is. If you're still recording such a high number, what does that tell us about how COVID-19 is spreading amongst the community there?
So, as you say, I mean, hospital admissions are only one indicator of the number of cases, obviously, and how the epidemic is running. And as I said, it's plateauing. Clearly, there, as well as the hospital admissions, there are many that are being tested still, even in the Western Cape, who have mild infection and do not require hospitalization. And then, you know, the actual number of people that are infected is probably in a factor of around 10 times the number that we actually know about from the test results. So those are the sort of numbers we're dealing with. But I think the important thing, as you mentioned in your question, really is that all of those things currently have plateaued. And I think the hospital, the patients coming into the hospital actually does give us a fairly good indicator of that.
Let's talk about some of the treatments that you are giving to people right now and the success of those treatments. I think we'll get to the specifics of what those treatments are that have been proven to be really successful. But do you think the fact that the world knows more about the disease is contributing to what some see as a much less mortality rate than was initially reported of COVID-19 when it was still initially in Europe and starting to hit different parts of the world?
Yes, I think so. I mean, firstly, we have better tools, as you mentioned, with dexamethasone. But also we have learnt with time, we've learnt from experiences from other countries, but also from our own experiences in South Africa. It's not just about dexamethasone. I mean, one of the main issue with COVID-19, as you know, it's a respiratory infection. People get severe pneumonias and the oxygen levels go down. And we've been able to support people in hospital far more effectively now with higher levels of oxygen support outside of the ICU. And these procedures, such as the use of what we call high-flow nasal oxygen, has prevented the need in a number of patients for going to the ICU, for having to go on to mechanical ventilation, which we know is very high risk and carries a relatively high mortality. So we have better tools, we've learned a lot, and I think South Africa is improving in our management of COVID-19.
When it comes to things like taking patients who need that kind of treatment onto ventilators and assisted care as you're talking about, have we as a country gotten to the point where we have exhausted those resources, or are we finding that there's a particular place where many patients either stop at just receiving oxygen and then being okay, and very few ending up on ventilators?
Yes, so I mean, if you take all comers who are admitted to the hospital, only a very small percentage of those will actually go on to require mechanical ventilation on a critical care, intensive care unit. Others will range from just requiring very low levels of oxygen support, usually given through either some little prongs into the nose or with a face mask. Some will require slightly higher levels through specialized face masks. And then there's these patients who we're giving this high-flow nasal oxygen, which, you know, is a step before one would need to ventilate. So it's a broad spectrum of people who need oxygen. And then there are people admitted to the hospital with COVID-19 who don't actually require particularly oxygen support. It's a lesser percentage, but there are people who are presenting with more severe complications of diabetes and other manifestations. But predominantly it's an issue of a respiratory illness, pneumonia requiring oxygen support, and then these other medicines like dexamethasone that you've mentioned.
We know that those that have really been carrying the burden of this disease have been our frontline workers, and that includes men and women like yourself who've literally had to go into the site and the territory of danger and help to heal people. Speak to me about what that experience has been like, because many health workers are talking about just how traumatic it all has been.
Yeah, so it's a mixed bag of emotions around this, because, you know, on the one hand, I mean, we have a job to perform, and I think that the healthcare workers, the nurses, doctors, and all our healthcare worker colleagues have done an outstanding job overall under, you know, really serious challenges of patient numbers and really severe disease. It's engendered really quite a sense of teamwork and camaraderie, certainly, you know, from our experience within hospitals. And, you know, the critical thing in our hospital, and I hope in many, and we would certainly recommend it as an approach in our hospitals, is to have really a whole of hospital approach. I mean, as a respiratory infection, traditionally pneumonias are treated by physicians in departments of medicine. We've had incredible support from departments of surgery, radiology, gynecology, all across the entire hospital. And those members of our hospital clinicians have come forward and been part of the teams and part of the COVID response. And I think it's a model which is, you know, extremely useful, because the intensity of managing and caring for patients who are very sick is extreme. And we do see high levels of burnout in our nurses who have taken a huge amount of the responsibility, and in our clinicians. So getting as many people involved in the hospital as possible has really been critical. And now that we're at a slightly lower level, albeit at a plateau and still seeing fair numbers, I think that has slightly given us more time to step back. And one has to now also appreciate and bring into the conversation a lot of the healthcare services that have perhaps suffered in this time, albeit with the understanding that COVID-19 has not gone away. We've plateaued. But there is cause for hope that our health systems will now be able to cope a little bit better if this continues or reduces further.
How do you manage the burnout, especially of staff that are overwhelmed? Because if, in fact, the numbers aren't going down in a province like the Western Cape, they've simply plateaued. It means that you still need everybody working at the rate that they've been working in order to adequately respond to the current need.
Well, it's important to say that they have plateaued at a lower level than our maximum. We were seeing, for example, in our hospital, we were seeing 50+ patients with COVID being admitted per day. Now that level has reduced, probably to around 25 to 35. So, when that happens, there is a little bit more time and space within the organisation of clinicians and nurses within the service to be able to give some, to try and bring in breaks and try and address burnout. The other way of addressing things, critically important to us has been amazing support from our psychiatry teams, our mental health teams, and the palliative care teams to really take on some of the intense burden of dealing with very sick and indeed end-of-life care occasionally, which also can be very stressful. But it's about trying to build into the system some time for people to have rest. And at its very peak, that was incredibly challenging in our own hospital, and I know in many hospitals throughout the country, even now, that is a real problem. And it's about numbers on the ground, I think, and trying to put in systems in place to optimally manage patients to the best of our ability, while trying to look after the staff as well, because our frontline healthcare workers are our most valuable asset in South Africa. And we have an incredible level of commitment and expertise and willingness to be involved. And that's really, if anything will carry the day, it'll be that.